Let's welcome Dr. Hani Farouk, Director of Strategic Initiatives from Accord Business Group, a golden partner with SAS. Welcome. He is here to talk about data and advanced analytics for health, from nice to have to mission critical. Dr. Hani has over 24 years of experience. He has worked in over 40 countries in the domains of digital health, AI, ML, mHealth, and formulation of national and regional strategies. Formerly, he was the head of the World Health Organization Center for Information Systems and Technological Innovations, which he established for Africa in the year of 2016. Welcome.
Assalamu alaikum. Thank you, Ms. Noura, for the introduction. Good afternoon, everyone. What Ms. Noura did not mention is that I actually was raised a few kilometers from here in a very nice place called the Dar'iyah. So I'm basically, I consider this my home. It's always great to be back to the kingdom. When I started thinking of the presentation to deliver, the message to give to you, I thought of speaking about new innovations, advanced technologies, collaborative intelligence, talking about those advanced features and how they can help achieve our vision, your vision, for your organization, for your health system, for your countries, on top of which is the Vision 2030 for the Kingdom of Saudi Arabia. But then I also thought of talking to you about the long list of those strategic actions documents, the resolutions from the World Health Assembly, and the latest global strategy on digital health for 2020-2025, which is, by the way, a great document to download and read. But then what I noticed is that I'm still talking with the voice of nice to have. And what I want to do is to shift the paradigm of the audience to think of how critical it is to implement the existing applications for advanced data and analytics in your organizations, instead of thinking of how nice to have this or to have that. So indicators and research shows that there is an increasing demand for more analytical models by 25% on an annual basis. Also, the research shows that by 2025, nearly all employees will leverage data to support their work. But still, also, the findings show that only half of the projects are eventually deployed when we talk about AI and machine learning. So the reality is that we need to focus on what exists now and really implement that. So I will start with a quick story to put you on the same page as I am. This story is from Africa about a disease, an ugly disease, which is the poliomyelitis, shalal al-atfal, polio. And actually, this disease was agonizing to humanity. We had the vaccines in the early 50s and 60s. We had the immunization introduced at the 70s. Then we established the Global Polio Eradication Initiatives in 1988 with the objective to eradicate polio in the year 2000. What happened is that we were able to eradicate that in the 47 countries of the African region in 2020. And this is the interesting message I want to deliver is why the delay of 20 years and what changed that led to the success in the eradication. Actually, 7 or 8 years ago, the Global Polio Eradication Initiative developed a report trying to understand why we did not succeed so far in eradicating polio. And the report, they wrote a statement with one word that information could be a suggested domain of focus. For maybe that would solve the problem because we have the vaccine, we know the children are there, we deliver the vaccination, but why still the disease is there? And it was picked up by the World Health Organization in Africa. I was assigned to develop, to establish the regional Center for Technological Innovation and Information Systems. And strangely, in less than 5 years, we were able to eradicate the disease from all 47 countries. Look how strong this simple message is. We had a container and we were a team of 8 people for 47 countries. Look at what was done there. This is one cycle, just to simplify things. So a community informant or al-aqil, someone in a village, identifies a child with potential paralysis and sends an SMS. We are, in a basic environment in Africa, low resources. So SMS messages sent and populated to all levels from the nearest facility up to province, national level, the Ministry of Health, and regional and global organization. And that triggers district health officer to go investigate the case, take the sample, take it to the lab, receive the information, confirmation of the sequencing, and send the information back to all those levels. And that triggers, again, campaigns for vaccination of children and taking samples from the sewage, the environment. We are trying to trap the virus, okay? Imagine the volume of the data for such a cycle with a lot of people in the back at different levels for assessment, planning, training, sensitizing, supporting, analyzing information, developing models and estimation algorithms, and then dissemination of the information. Okay? This is what helped to eradicate the disease. It's not that we had the vaccine or so. Data management, 2 keywords, keep in mind, integration and automation. Those are the 2 keywords that I put on the table for all colleagues, teams, and the network. Integration of data from different sources with the right standards and structure, and automation of data cleansing, processing, analysis, information production, and dissemination. Okay? Now, let's talk about the health system and the data that is needed. Now, what I want you to think of, I will give you areas of functionality that I'm convinced that this is a must nowadays. We are humbled by the COVID-19, this outbreak that gave us a harsh lesson to humanity that we all live on the same boat. Poor, rich, low middle income countries, high income countries, we are in the same journey. So it's the same concept here. The health system has basic 6 components. Normally, the service delivery, the health workforce, the workers, physicians, nurses, and so on, information, medical products and technologies from beds, drugs, all the hardware, software, and so on, the finance and the leadership and the governance. And these are the targets most of the service delivery organizations, health system want to achieve: improved health, improved responsiveness, increased social and financial risk protection, and improved efficiency. And this is done via improving access, coverage, quality, and safety of the services. Now, look at those 6 components with the people or the citizen or the patient at the center. I want to give you quick examples of applications for different areas, different stakeholders in the domains of data analytics. If you look at the governance, and I'm not talking about the data governance, I'm talking about Elhalhuli for the health system, okay? Those are the areas that even at ABG and our partners, we implement applications for in different countries. Risk assessment and prioritizing and identifying population at risk. The monitoring and evaluation of outcomes, having those غرفة العمليات, the control rooms with the dashboards, analyzing information from different systems to be able to identify the gaps or the delays or deviation from the outcomes, and then applications that we implement for research and for clinical trial. Of course, there's a lot of application. 15 minutes is not enough, and you're welcome to visit us and we can discuss and give you more details. If you look at the finance sector, the health insurance companies, charity organizations, and others, the applications that exist now and is a must, you cannot rely on the traditional work anymore, is for healthcare financing analysis, the fraud and cost containment, health insurance claims, fraud and financial crimes, investigations management, and the procurement integrity. And the last one is really interesting because now organizations, entities, even countries, they join hands now for to have the same procurement, we call it unified purchase processes, to have the best prices for the group or for the alliance. If you look at the service delivery, I will just mention 2 for the sake of time. The first one, of course, is the satisfaction, customer satisfaction, the patient and member experience, the 360 information around the citizen, and the automated monitoring of the hospital-acquired infections. And this is really an important area that we in SAS, we have applications in. The health workforce, human resource optimization, the monitoring of the capacity. We discussed with a lot of colleagues here, and they have ideas. They talk about capacity building and training, but they have not done the proper analysis for the prediction of the capacity that is needed in the near future, not to think of being event-driven, what training is needed. Now, the result-based management and the workload and the stress management of health workers. And finally, for medicine and technologies, maximizing this domain has stakeholders of suppliers, manufacturers for those equipment, maximizing the equipment performance, medical resource optimization, the vaccine distribution and administration, the demand forecasting, very important, and optimizing supply chain. So this is a list that, from my opinion, I consider is a must nowadays. It's no longer a nice to have thing. So how we go about the implementation, we don't jump into applying technologies immediately. We have to have those steps to have this strategy to develop. These are the different stakeholders around the citizen, and more, of course, providers, payers, governments, pharma, and so on. If you look at different stakeholders, you will see that they go through a journey of like 5 stages, from experimentation to mainstreaming of technologies, and basically you have to identify which of the 3 areas you are in. Are you strengthening infrastructure, starting to making the case, or are you strengthening existing applications and the environment, or are you an advanced organization or entity or a health system where you're now scaling up and thinking of integration, cost effectiveness, and new innovations. So it's a different journey for different levels, and for that you need to think of the 7 key components of the environment, supporting environment for your applications, which start with infrastructure, standards and interoperability, services and applications. To the right, the legislations, policy compliance, and the workforce, and strategy and investment, and on top of that, the leadership and governance. And each area has its own applications and assessment of maturity and so on. And the World Health Organization, in collaboration with the International Telecommunication Union, has developed a toolkit. I'll be happy to share that with you, with a lot of checklists, sources and processes on how to go about this implementation. Basically, you need to develop 3 components: the vision, based on your current situation, the context you are in, your objectives, the gaps that are available, and your level of maturity, and then series of projects, detailed project plans, and then the monitoring and evaluation framework so that you can track the progress or the deviation from the outcomes. And the toolkit supports all that. We have the experience also. I would be happy to answer any questions that you might ask. Finally, I would like to talk to you about some challenges and concerns to keep in mind. The first one is about the awareness. It's a gap, either awareness of the problems that you have, or the awareness of the solutions that exist to meet this need or challenge. And this is usually at the highest level, and it is your role in your organization to diffuse the information for the leadership to support the implementation. The regulations, it's a big issue, whether within the organization or for the whole country. I've seen some countries with regulatory frameworks that hinder the access to data or sharing of information between even government entities or cross borders. This is an important area that you should think of as an ambassador. Try to point out those blockages in your entity or organizations. The governance, unfortunately, in the health sector, usually such work is not led by the health experts. It's led by the ICT experts, whoever they are. And the problem is that this partnership is not properly established. They leave it to the IT people to think of and implement, and it's doomed failure if it is this model. It has to be under the leadership of the health sector, the health professionals. The investment, and this is a big, again, a big concern and challenge, because usually when you speak to the decision makers, you see competing priorities between investing in such domain versus the other traditional or pressing needs for capacity, for infrastructure, for bids, and so on. The interoperability, and in the first, at the beginning of the day, I heard my colleagues covering this point, and it's really important to understand this bottleneck or challenge, where the lack of agreement on standards result in having problems with seamless data exchange. And recently I heard, just this week, Johns Hopkins announced that they have developed a tool to be able to access the information and transfer it from electronic medical records into an open source to support research. They faced a big gap during the COVID and actually it's almost every country, when we were hit with the pandemic or the epidemic, the problem was to collect information from different health entities to be able to see the big picture. The adoption, and here I want to show you, or the adoption by definition is simply the acceptance of the concept and the continued use of the tools. And this is a study that I did, concluded in 2019 with Maastricht, a model that was developed to try to see which factors that influence the intention of health workers to use such tools and technologies. And I just want to highlight some of the findings. The perception of the workers that such thinking of data analysis, even just to understand or use the outcome, is adding more workload to what they do, is actually part of the factors that hinder their attitude, change their attitude towards the use of such tools. The perceived usefulness of such tools, comparing what we talk about now with the traditional ways they do business, thinking, no, what we do is far better, and of the perceived ease of use, how easy it is to learn the simple ways of interpreting the information and data, the anxiety about making mistakes when using systems or editing or working with the data, the professional autonomy, a big problem for the physicians, thinking they have this competing feeling with the technology, like how come a system contradicts my decision for treatment or for a prescription of drug for whatever reason, and so on. So the adoption is a big challenge. You don't just introduce a tool or technology or a system or a concept and you think that everybody will use it properly or will accept it. You have to understand the culture and the nature in your organization. Another point is related to the ethical concerns, which is my last slide before the conclusion, is related to the use of the data and the access to data. Actually, a study that we did several years ago, still valid, shows that the the region here still is not advanced in honoring the ownership of the data for the citizen or the patient, to grant him access to his information, to be able to update the data, or even to have a decision on who has the right to access my data for my treatment or for research. So this is a big issue that needs to be highlighted as well. Finally, final note for colleagues, decision makers, CTOs, CIOs, and leaders: you have to approach the process your own way, according to your level of the size of your organization and the level of maturity of your team and the results of the maturity. The toolkit that I mentioned, you don't have to implement it holistically. You can use just one module or part of it according to a priority area that is identified. You need to understand that any changes in the environment, that pandemic or an epidemic or a change in the culture, should trigger a review of all your plans, for your plans to remain relevant. I see expired plans years ago that are still in place for organizations, despite going through the previous unique 2 years. The patient is at the center of everything we do. I've seen the mistake of putting the health worker at the center, of putting the currency at the center. the money will come, workers will join in, everything will work fine as long as you put the citizen or the patient at the center. And finally, a step-by-step approach yields concrete results. I will stop here. Thank you for listening to me, and we are available to answer any questions. Thank you so much. Shukran.